plan. And let me conclude by saying this. If you are old and you have no health insurance, you're 55, 60 years of age, and you have no health insurance and you're sick, you will die. You may die because you can't get to a doctor when you should.
Wait, let me ask you about that, Senator, because you've said that if this repeal and replace plan goes forward, thousands of Americans will die. Where do you get that estimate from?
I get that estimate from the fact that studies have been done that people who do not have health insurance, who do not go to the doctor when they should, who do not go to the hospital when they need to go, in fact die. And thousands of people die every year because they don't have health insurance. And if you throw 24 million people off of health insurance, there is no doubt that many thousands of people will die. Look, Jake, I have talked to doctors in Vermont and all over this country who see patients who walk in the door and they're really sick, and the doctor says, why didn't you come in when you first had your symptom? And when the patient says, well, I had a high deductible or I didn't have any health insurance, I didn't want to come in. Sometimes it is too late to treat those people.
Senator, but you know that in many states, Obamacare is in dire straits. The governor of Minnesota, a liberal Democrat, said that the Affordable Care Act is unaffordable.
Right.
According to HHS, in 2017, there's going to be a nearly 25% decline in the number of insurers participating in Obamacare compared to 2016. Don't Democrats own this bill that in many states is failing?
No, I think what what you're saying is true. No one denies, certainly not me, that the Affordable Care Act, Obamacare, has many serious problems. Deductibles are too high, premiums are too high. We still have too many people who don't have any health insurance. It's too complicated, it's too bureaucratic. Let's sit down and address those issues. There are many working people who, under the Affordable Care Act, cannot afford their health care. That's true. Let's deal with that. The solution is not to throw 24 million people off of health insurance and substantially raise premiums for older workers, and furthermore, to cut Medicare, to cut Planned Parenthood, to defund Planned Parenthood and throw millions of people off of their choice of health care right now.
Senator, let me ask you, you talked about the high deductible